Welcome to Kidney and Tell. Hi, I'm Terrie, and I'm a renal dietitian. And in this video, we are going to review what phosphorus is and why it's so important to our bodies. And then we're going to review the two different forms of phosphorus that is found in our food and how they're absorbed in our bodies. Now, if you have kidney disease, you may have been encouraged to follow a low phosphorus diet. And have you ever Googled a low phosphorus diet or given a handout on a low phosphorus diet from your healthcare provider? It can be a little bit confusing and conflicting. So let's get started and learn more about phosphorus and the role that it plays in our body. Phosphorus is the second most abundant mineral that's found in our bodies. Phosphorus is essential for strong bones and teeth and helping our bodies to create energy, as well as for our overall health. For people with chronic kidney disease, high phosphorus levels in our bloodstream can have some side effects on our bodies. A short-term side effect is our phosphorus level is too high. It can cause itchy skin, and generally we'll find patients complaining about itchy skin when their phosphorus level gets above 6.0. Once we're able to return that phosphorus level to more with an acceptable range, that itchy skin tends to subside. However, a long-term side effect of high blood phosphorus levels, if they go untreated or undetected, it can cause bone and joint pain, and it can cause weakened bones. We call this bone mineral disorder. And we can have increased calcification of our vascular system. Now, in this visual, you'll see that there's a lot of phosphorus circulating in our bloodstream. And phosphorus acts as a magnet to calcium. And as that phosphorus is filtering through our blood, it's attracting calcium to be pulled from our bones into our bloodstream. And this can cause weakened bones and bone and joint pain. And now with all this excess calcium in our circulating in our bloodstream, that calcium needs to go somewhere. So it will start to cling to our artery walls, calcifying those arteries, making them a lot stiffer, and can put us at greater risk for heart disease. So if you have Googled a low phosphorus diet, you might see that it's recommended that you only eat white bread, white rice, white pasta, and to avoid foods like whole grains, beans and lentils, nuts and seeds. Well, I'm happy to tell you that that information is old and outdated. The good news is phosphorus in our diet has been redefined. Over the last few years, we have learned that there are two types of phosphorus that's found in our foods. The first form of phosphorus is organic phosphorus. It's found naturally in our foods. It is found in animal products such as meats, fish, chicken, dairy, and cheese. It's also found in plant-based foods like whole grains, beans and lentils, and nuts and seeds. The second form of phosphorus is inorganic phosphorus, and this form of phosphorus is added to our foods by manufacturers as a preservative or as an additive. So I tell my patients, if any of your foods come in a box or a package, a jar, or a container, it's very likely that these foods contain inorganic phosphorus. You might find it in baked goods or protein bars or coffee creamers or deli meats or fast foods. The main difference between these two types of phosphorus is how much our body absorbs in our bloodstream. When we look at organic phosphorus found in plant-based foods, it is believed that we absorb about 20 to 50% of phosphorus found in these foods. It is because plant-based foods contain something called phytates, and phytates will bind with minerals while they're in the digestive system and prevent phosphorus to be absorbed into the bloodstream. Animal protein is a moderate amount of phosphorus that is absorbed from these types of foods. It is believed that we absorb about 60 to 80% of phosphorus coming from animal protein. So let's review one of the many roles that the kidney plays in our body, and that's filtering the blood. If we were to look at a cross section of the kidney, we would see that there are millions of tiny little microscopic tubulars that filter the blood. And the kidneys filter about 200 quarts of blood every day. And as it's filtering the blood, it's helping to remove excess phosphorus out of the body through the urine. But with kidney disease, and if kidney disease is progressing, we may not be able to filter out excess phosphorus as efficiently or as well as our kidneys were able to when they were working well. So that can cause increased levels of phosphorus in our bloodstream. Now, I'm a very visual learner, and I find that many of my patients also are visual learners. So I created a couple of visuals to show the difference of how inorganic phosphorus and organic phosphorus is absorbed in the body. When we look at organic phosphorus coming from plant-based foods, it is believed that our bodies absorb about 20 to 50% of phosphorus coming from these foods. The rest of that phosphorus, about 50 to 80% of the phosphorus, leaves the body through the stool. Looking at organic phosphorus coming from animal foods, our meats, dairy, fish, cheese, it is believed that we absorb about 60% to 80% of this form of phosphorus. 20 to 40% of the phosphorus leaves the body through the stool. The inorganic phosphorus found in processed foods that's used as an additive, it is believed that our bodies absorb almost 100% of this form of phosphorus, and very little inorganic phosphorus leaves the body through the stool. So let's recap. Phosphorus is an important mineral in our diet, and not all phosphorus forms are created equal. And I encourage you to consider eating more plant-based foods, knowing that we absorb far less phosphorus coming from these foods. I don't encourage you to become a vegetarian or a vegan in order to stay healthy, but just to be more mindful to eat more plant-based foods. And if you occasionally have processed foods that do contain phosphorus additives, it's okay. I don't want you to stress about it. I just don't want these to be a major part of your food choice. And in an upcoming video, I'm going to review inorganic phosphorus in more detail and explain why these phosphorus additives are used in the manufacturing of our foods, and help you to determine if a food contains phosphorus additives. And if you're ready to take the next step in protecting your kidney health, I invite you to visit my website called Kidney Intel and explore my online class called Kidney Essentials for practical, easy to follow strategies on nutrition and everyday choices to help support your kidneys. You'll find the link to my website below. I'm Terrie, a kidney dietitian with Kidney Intel. I hope that you found this video to be helpful. Please like me and share this video with someone who you feel can benefit from it too. Until next time.